These diseases merit our urgent attention as they represent a significant threat to public health. If we consider HIV/AIDS up to 2023, there have been a little over 1,500 AIDS-related deaths, with a total around 5,500 HIV patients being reported.
අධ්‍යාපනයේ නවතොරතුරු දැනගන්න නවලව TV YouTube නලින්.
So the campaign was started as the anti-venereal disease campaign in 1952, and it has evolved over the time as the National STI and AIDS Control Program of Ministry of Health Sri Lanka. And we are the coordinating or the focal point for the national response to prevent and control sexually transmitted diseases, including HIV and AIDS in the country. So the program goal is to end AIDS epidemic as a public health problem in Sri Lanka by 2030. So if I briefly go through the epidemiology of HIV and AIDS in our country, actually, for the audience who are not non-medical, maybe I should briefly describe the difference between HIV and AIDS. So HIV is the virus, the human immunodeficiency virus, which attacks the immune system of the body, and AIDS is the disease condition, acquired immune deficiency syndrome, and a group of diseases caused following severe loss of our body's immunity due to this HIV virus. So if we look at the data from the first local case diagnosed in 1987 up to last year, these are the published data from the national campaign. So the number of cases or the newly diagnosed people with HIV have been increasing, and I don't know whether you can see it clearly the year. For example, if we look at 2000, maybe 18, 19 or 2020, we had around 350 newly diagnosed HIV infections. But last year and year before, we have had more than 600 newly diagnosed cases. Actually, in 2023, that is last year, we had nearly 700 newly diagnosed HIV infection, which means there's almost double number of new cases of HIV last year. And when we look at our modeling and our estimates, we estimate that there are about 4,700 people living with HIV. However, when we look at the data collected over the years from the first local case, there have been over 5,000 people diagnosed with HIV, and there have been some deaths and loss to follow up. So by now, there are about 3,400 patients living with HIV under our care. That means registered with us, which includes 40 pediatric patients. Although we have highlighted the increase in the number of cases, Sri Lanka is still considered a country with low risk of HIV, because in the general population, when we look at the numbers and divide by our population among adults, the prevalence is less than 0.01. That is the reason why we are considered among one of the low risk countries. So these are the estimates, and but this slide I would really like you to understand and sort of look at the data very carefully. The green line is for children less than 15 years. So green line, although you may not see the year and the number exactly, but you can, I'm sure you can see the green line. It has been static, I would say static throughout. Those are the children. So we don't see much of an increase, alarming increase among children. The grey line is, of course, women 15 years and above, and that has also been kind of static throughout the year starting from 2010 to 2023. But if you look at the red line, those are men age 15 years and above. You can clearly see that the new cases detected are increasing among men adults. And I have the same data presented in a pie chart. The blue one is males, and the red color one is females. And far back in 1996, male-female ratio had been 2.2 to 1, 2 male to 1 female. But according to the latest data, it has been 7 to 1 ratio, 7 males to 1. And now this is the gender distribution. Then the other one I like to highlight is the particular age group, the youth, 15 to 24 years. I don't know whether it's very clear. I can explain it. Again, even among men, the increasing line is males 20 to 24 years. I am sure you can see the increase, the red line. That is males 20 to 24 years. So that is something that we have to be concerned. So that means the number of new cases are increasing among youth. We can clearly see that even in the data we have up to the third quarter. Now we have analyzed up to the third quarter, we see the same situation in the 2024 data. And if you look at the geographical distribution, you can clearly see, as Dr. Pramita mentioned, it's same for TB and HIV, I suppose. The Western province has the highest density. Of course, the population density is also there as a reason, but the coastal area is highlighted, Putlam, Gaul, Matra, Hambantota, and of course the Western province as high density areas. And when we look at the transmission, it's mainly the unsafe sexual practices, either vaginal, oral or anal. Then we have mother-to-child transmission as a mode of transmission, and of course by infected blood. When we further look at the transmission among males and females, because I talked a lot about having it high in males, so you have to look at the data separately among men and women, among how the transmission occurs. And among female, it's mainly heterosexual transmission. 97% of new cases last year among women were heterosexual, whereas when we look at data among men, majority is male to male sexual activity. Men having sex with men, or MSM, is 62% of the transmission. So that is something that we have to, if you want, we can discuss further. The same trend is presented here. The red one is the male-to-male sexual transmission. We call them MSM. Now they have become, the MSM mode has become the predominant mode. It was, you can see in 2019 it accounted for 46%. Last year it has accounted more than half of the cases. However, heterosexual transmission seen in grey is also high, but there's a decreasing trend. Mother-to-child transmission is, of course, we have, I will talk about it later also, mother-to-child transmission of HIV has become very low, and we have even obtained certificates for elimination of mother-to-child transmission. So, along with the HIV cases, we have seen the same trend among other sexually transmitted diseases also. Here you can see syphilis. Again the same trend among the highest among increases among male more than 25 years. Then congenital syphilis, gonorrhea, I would say the same trend, genital herpes, and genital warts. So about mother to child transmission, we have our program about testing all pregnant women, and as a result we have been able to detect the cases early and treat the pregnant women early. As a result, transmission from mother to child is very low in our country. So very briefly, I will talk about our national response. Now that you have seen the data, what is the national campaign doing to control this disease status? We also have our global targets. We call them 95, 95, 95 targets. So as I mentioned earlier, we estimate that there are about 4,700 people living with HIV, and we have to detect 95% of them. So far, our percentage is 88%, which means we have been able to diagnose 88% of people living with HIV. Once we detect a person, we have to start treatment. So, but sometimes we may not be able to continue or continue the treatment, although we detect them, because some of them may default. So, among identified persons, we have been able to treat 81%, which is fairly good, although it's not 95. As a result of early initiation of treatment, we prevent transmission to other people. And once on treatment also, we have to make sure that their viral load is suppressed. That target achievement is 86%. In general, we are actually happy with our targets, achievement of our targets, because we see there's an increasing trend. So our campaign works not only with the departments or the directorates of the Ministry of Health. We work a lot with other ministries. We need the support of multi-sectoral partners to carry out our program. So it's obvious that we need to partner with government organizations and also various other non-governmental organizations. We do work a lot with non-governmental organizations because the main reason is that why we work a lot with non-governmental organization is it's due to the nature of the disease. Sometimes the people with high risk behaviors or people living with HIV, due to the stigma and discrimination, they may not claim themselves as such. So we have to get the help of the non-governmental organizations for tracing, contacting people, high-risk people, case detection, referral, etc. So it's a little different model from the conventional model of delivering services through the midwife or the PHI. We do have their support for certain segments, but we have a very unique program where we get the support of the NGOs. If I briefly summarize the national response, it has two main components, the prevention part and the curative component. So curative component, I will first describe it. We have the testing program and the treatment campaign. But I like to draw more attention on the prevention activities. For our campaign has actually 4 preventive components. First one is the behavioral component. We target general public as well as high-risk people on creating awareness on safe sexual practices. And we also distribute condoms and lubricants. And we also promote people to seek care, to test themselves and to seek care if they are high risk. The second one is the biochemical intervention. Now this was started in 2019, and as a campaign we are promoting the biomedical prevention also. There are 2 components, pre-exposure treatment or prophylaxis and post-exposure prophylaxis. So now, we provide pre-exposure and post-exposure prophylaxis for high-risk situations. For example, pre-exposure prophylaxis is given to high-risk individuals like MSM because of their high-risk behavior in situations where they do not prefer to use condoms, and after a consultation after seen by the consultant or at least a medical officer. We register those high risk people and provide this pre-exposure prophylaxis. It's a just one tablet per day. For 1 month, we give the first prescription and continue throughout. Then post-exposure prophylaxis is also originally started for occupational exposures like needle prick injuries, but now since 2 years we are providing post-exposure prophylaxis within 72 hours of a high-risk sexual exposure, again on prescription after seen by a consultant or a medical officer. It's not freely available in the market, it's not available in pharmacies, it's not available in the private sector also. It's exclusively provided by the national campaign at the moment. Again, due to the we have concerns about drug resistance also, so at the moment it's closely monitored by the campaign. Then I described about the EMTCT program, where it's also part of our prevention activities, where we provide screening free of charge to all pregnant women registered in our maternal and child health care clinics, and then try to detect the disease early and treat the detected pregnant mothers and also treat the newborn child. So these are the main preventive services. In terms of testing, I like to also mention that in addition to the testing provided at the clinics, we have our own website where there's a chance to order the test kits, the self-test kits, and then we courier them to the people who request it free of charge, and that is also another way of promoting testing so that we can get the disease early. All these are done because we have kept our prevalence very low. We are a low risk country because we have put lot of effort on prevention and early detection and also treatment. But at the same time, we also we have realized the stigma and discrimination associated with people living with HIV, their families and their associates. So we do have lot of programs for prevention of stigma and discrimination also. So HIV testing, I talked about it. We have the rapid test, the lab-based test, as well as the self-test. So that is promoted, and as a result we do conduct more than 1 million tests per year throughout the country, and that is one way of early detection. And if you look at this data, I don't know how clear it is. There have been, I just thought I'll talk about this because there have been a lot of social media posts also about having blood being infected with HIV. So we have tested more than 400 blood samples, blood donations, and only 56 patients people were found to be positive with HIV with a prevalence rate of 0.01%. So we target our programs mainly to high-risk people. We call them they are called key populations. You can see the key population, and I'm sure you can by going through the epidemiology, the trends and everything, you must have realized the high-risk populations. The sex workers. Now it's not only female sex workers, so there are male sex workers also, so we call them sex workers, men having sex with men, transgender populations, people who inject drugs, although it's not a big problem. There are certain populations that use injectable drugs, and then prison inmates are known to have this high-risk behavior and the infection. Beach boys segment is conducted in certain parts of the country, and there are other vulnerable populations like people who return from migrants who return from overseas work, armed forces, tourist industry, etc. Because our prevalence is very low, we target our programs to high risk population. That does not mean we are neglecting the general population. We do have, but our efforts, especially the global fund donations and everything, is more targeted towards high risk populations. Then finally, we offer our services throughout the country. In terms of universal healthcare, we do have a clinic in every district. Altogether, we have 40 clinics, and in 32 clinics, we have a consultant or an acting consultants, and anyone can walk in. Sometimes it's through appointments, but everything, the testing, treatment, and in all the prevention, the condoms, everything is provided free of charge by the government, and the campaign purchase the drugs, reagents, test kits, everything, and delivers throughout the country.
මේ අපි ඉන්නේ පෝට් සිටි. එහෙමත් නැත්නම් වරාය නගරේ. මේ ගොඩනැගෙන්නේ ඔබෙත් අපෙත් අනාගතේ. මේ නවලව TV සබ්ස්ක්‍රයිබ් කරන්න, ලයික් කරන්න, කමෙන්ට් කරන්න, ෂෙයා කරන්න.